main difference between these type 2 JAK2 inhibitors and all of the other clinically approved agents, which are type 1 inhibitors, is simply where on the JAK2 protein these compounds are binding. So, with the clinically approved agents, these type 1 inhibitors, they bind JAK2 in an active state. So, even though you're getting downstream signaling inhibition, the JAK2 protein almost remains primed for action. And we think it's that which contributes to why MPN cells might persist in patients who are receiving these therapies long term. The type 2 JAK2 inhibitors bind the inactive uh, form of the JAK2 protein. And so we think that by potently suppressing inhibition in this particular setting will, again, not only completely shut off these downstream pathways, but overcome these mechanisms of persistence that, again, not only will prolong treatment response with JAK inhibitor, but also maybe even reduce that MPN tumor burden. So we'll see.